According to the World Bank estimates, Nigeria's maternal mortality rate, MMR, is still as high as 800 by 100,000 live births. This means in every 10 minutes, one woman dies on account of pregnancy or childbirth in Nigeria, giving a total of 53,000 per year. Katsina State, like other parts of northern Nigeria, faces significant challenges in reducing maternal mortality rates. Alongside 4 other states in the northwest region, Kano, Sokoto, Zamfara, and Jigawa, it is identified as having some of the lowest performing maternal health indicators. Contributing factors include limited access to healthcare facilities, poverty, and cultural barriers that hinder the utilization of health services by pregnant women. One organization addressing these challenges in Katsina State through cutting-edge technology is Datharm. Datharm brings innovative tech solutions to maternal health care in underserved communities.
My name is Amina Ahmad Kabir Usman Nagoko. I'm from Katsina State, from a very traditional family in Katsina State. I have a background in software engineering, master's in management. I worked for a couple of years in Kuala Lumpur as a software engineer. MCH Track is an application that helps to link communities with health facilities or streamline the processes of strengthening the linkages between community and health facilities. We deployed a system where community health agents can use to record households that are in need of interventions, such as pregnant women or children that have never been immunized. And that data is now transmitted to health facilities, so that health facilities are aware within this their catchment region, so and so are in need of, interventions, routine immunization, antenatal care. Some states even diarrhea, malaria, health service interventions. So health facilities can plan for it, in terms of drugs and commodities, and they can also plan their time in anticipation of who will come to the facility. For those that are not compliant with uptake of services, for example, a child that has not been immunized and is supposed to be immunized, there will be a lot of reminder using the community agents to that household. Please bring your child for immunization because of these consequences. So that linkage is there. My great-granddad, my granddad, my dad have all been in the system of public service traditionally. My great-granddad has been an emir, my granddad has been an emir, my dad a district head, my uncle an emir. So in their own way, they work with the communities.
What Amina is doing now is to other people, also some people, it will be something different. But to me, our father, it's in our blood. We love serving people.
So the is developed to revolutionize the antenatal care or the routine immunization efforts in Nigeria. And they have, the way it is developed is to solve many, some health-related challenges, especially the one related to the pregnant women, the children, the caregivers, so that the moment we are able to track their health record, we'll be able to refer them for health care, refer them to facilities for health care, and also ensure and track that, okay, this health is actually being delivered to them. And this app is user-friendly in the sense that it has 3 major features. The first one is line listing. The second is tracking of the records of the patients. And the third one is making it available for the participants and even the users to take their health records and also refer them to the facilities. So that's the summary of what MCH Track entails.
MCH Track is a game changer for maternal and child health in Katsina.
This technology connects health workers with caregivers through community resources groups who help generate demand for primary health care services, especially maternal and child health care.
The whole essence of the project is centered around on the 5, as well as to also increase access for antenatal care. The project is still under pilot, but we have covered about 66 wards, covering about 363 settlements. And we have also listed over 13,000 women and children. That is where we identify them and linked them to a health facility. For pregnant women, those that are pregnant, the whole essence of the program is to identify those pregnant women in the settlements, link them to a health facility so that they can access care, especially antenatal care. While if it is under 5, they will identify those they will identify a child that is under 5, also linked that child to a particular health facility so that he can be able to access routine immunization.
Key features of our maternal and child health track software. 1. Antenatal care management. This app enables easy tracking and monitoring of the progress of pregnant women throughout their pregnancy journey, from initial consultations to delivery preparation. 2. Postnatal care support. The app also ensures that mothers and newborns receive the necessary follow-up care and support after childbirth, thereby promoting healthy recovery and well-being. 3. Immunization tracking. Through the app, it is easy to keep accurate records of immunization schedules for mothers and children, helping to prevent the spread of vaccine-preventable diseases. 4. Health education resources. The app also grants access to a library of educational materials and resources on maternal and child health topics, empowering healthcare providers to deliver comprehensive care. 5. Data analytics and reporting. Through the app, they can also generate real-time reports and insights to identify trends, measure program impacts, and inform evidence-based decision-making for improved maternal and child health outcomes. Since its launch, MCH Track has transformed maternal and child health care in Katsina. Monthly dashboards ensure no child is left behind in receiving immunizations and other essential care.
Sunana Yusuf Salisu daga nan asibitin Sabon Garin Wayo. Gaskiya mun ji daɗin wannan app da muke amfani da shi da wannan device ta waya MCH Track. Wannan abin yana ƙara taimaka mu sosai wajen aiki da gano wanda ya kamata su zo da marasa lafiya da patient har ma masu allurar rigakafi. Duk wannan app yana taimaka mu wajen a bi su gidaje, a turo su asibiti domin a yi musu magani, a yi musu abin da ya kamata. Wannan app MCH Track app yana taimaka mu sosai wajen musamman wajen mata masu juna biyu.
Akwai wani gida da muka je, yaron yana hitar baya. Idan muka tambaye ta sai ta ce ai su sun dauka lafiya lau ne, ba wata matsala. Sai aka ce masa akwai matsala, muka yi referral ɗinsu zuwa asibiti, aka yi treating ɗinsu. Daga nan sai aka yi referral ɗinsu zuwa gidan dawa, aka ba su magani. Yanzu yaron ma ya warke lafiya lau. Visit reminder yana taimaka mu wajen za mu yi visiting ɗin wa'anda lokacin dawowarsu yayi ba su dawo ba. Za mu tunatar da su lokacin yayi, za su kawo yara immunization. Sai kuma defaulter yana taimaka mu wajen idan mutum lokacin dawowar shi yayi bai ba, za mu yi defaulter ɗin shi, mu tunatar da shi lokacin dawowar shi immunization yayi bai dawo ba.
It is important at this time around to embrace our technology in dealing with health issues. And this innovation of the program MCH Track is a very laudable innovation, which Katsina felt that we should be able to take it up and to champion it, and also to ensure that our health institutions benefit from the program. In fact, I must say that it has been in line with the vision of the administration to ensure that we promote use of information, ICT. That was the reason why the agency, when we came on board, we were able to create an agency or directorate in charge of ICT, and we gave a young and vibrant person so that there is nothing you can do, there is no any development that can take place without data. And data is key in doing all these things. And I must say that we are very thankful to the Datharm and the Gabi UNICEF collaboration to facilitate the MCH Track innovation. And it's in line with what we have already started in Katsina, because we introduced e-health solution in the state in our major tertiary and secondary facilities. And we want to expand to ensure that at the local level, as I speak to you today, Katsina is able to, is in the process of upgrading and restructuring our health facilities in each ward. In fact, as at today, we have already awarded contract for about 150 PHCs across the state to ensure that they are functional and they operate 24 hours. And the reason behind that is to ensure that we reduce maternal and child mortality. And this program is a program that enhances immunization. It's a program that helps the pregnant women to keep track of them, to get the details of them, and also to facilitate how it's being handled at that level. And I think it's something that we can be able to expand to reach all those functional primary health centers that we are about to commission, to be of much of benefit to the people of Katsina State. And I want to assure you that the state government is willing to support all these innovations and to work with you. It has started yielding results from the data I saw, and I think it's something that we need to move forward. I think it's something that we need to scale up and try to improve on it. You know, there is nothing meaningful anybody can do, whether in health, in education, in whatever, without the necessary data. Every child should have the opportunity to get immunized, because as long as those children are immunized, it reduces the volume of going to hospital on a daily basis, and then all these kind of diseases that leads to disability will not be there. So I think it's something that as a government we need to encourage, we need to facilitate, we need to support, and I'm giving you all my assurance that Katsina State is really ready, and that is why we are championing it, and we'll continue to champion it, and we'll continue to support it at whatever level possible.
We have recorded a lot of success, like we identify more than 2,900 zero dose. So we use this as an advocacy, and Katsina is one of the LGAs, is one of the recently, based on the NGHIS survey that was released just towards the end of this year, just last month, it was in terms of the Penta-3 coverage, we are among the best 10. In terms of the measles 1 coverage, we are also among the best 10. In terms of general access, fully immunized, we are also among the top 10 in Nigeria. So looking at this, all these successes we have recorded, is MCH Track is part of the strategies that we use in our Gabi PSC MOU to achieve these strategies.
Implementing MCH Track hasn't been without challenges, from technical issues to cultural barriers. But the dedication of health workers and volunteers has made a lasting impact.
The major challenges are not far away from infrastructure. You know, we have issue with non-connectivity in most of the rural areas. So this is one challenge that we need to overcome. And then also there is challenge of power, that in some of the facilities at the rural area, they don't have electricity, in which you need electricity to power your laptop or your tablet or whatever to be able to transmit result immediately, which sometimes take a bit of time. And then there is also an issue of insecurity in some locations, especially at local governments that have that borders the forest and have this issue of bandits and what have you. But that has also been overcome drastically. I can say that it has reduced drastically. And most of the facilities, the workers can go to those facilities. They can be able to perform their responsibility and functions. Our aim is to ensure that by the end of this administration, the 361 wards in the states will have functional primary health center that can operate 24 hours. And in those health centers, we provide solar energy, we provided houses for the staff, we provide a keke ambulance that can use it to move serious cases to the secondary facilities. The aim of doing that is to reduce maternal mortality rates, because pregnant women mostly died as a result of loss of blood, as a result of care at the time of delivery. And then most of the child, we used to lose them at the point of delivery, also a few days after delivery, because of lack of necessary hygiene and care that is needed. And I think it makes even the immunization more critical and more simpler and easier.
Building on our continued success in Katsina, MCH Track is poised to expand across Nigeria, paving the way for healthier futures for mothers and children nationwide. One of MCH Track's most groundbreaking innovation is its integration of community leadership into every step of its implementation. As we prepare to launch our scaled-up initiatives, Datharm is pleased to honor the invaluable contribution of Magaji Yarakuma, the village head of one of the first communities, where it piloted its digital health interventions for pregnant women and children. His steadfast support has exemplified the power of community and the extraordinary impact one individual can have. As MCH Track grows, it continues to empower communities, combining traditional strength with innovative solutions to create a brighter, healthier future and to reduce the rate of zero-dose children in Katsina State.